Lieutenant Governor Coleman has been a champion for children and children's mental health. She has been a champion for our schools, for our teachers, and she has challenged us to make sure that we understand the voices of youth, including them in everything you've done, and challenged us to make sure that we do as much for children's mental health as possible. Your leadership has been inspiring. Thank you.
Good morning. I probably don't have to tell you all this, but you know how wonderful Secretary Friedlander is and that he is a champion in this whole arena. We are so grateful to have him as a key part of Team Kentucky. Probably didn't know how much of a key part you were going to be because we didn't know a pandemic was coming, but you hung in there and you guys did a great job. And also for MC, Cameron was talking, he left out that he's in the military on all those other things, right? And I just told him it's time he needs to get up and do something with his life. He didn't have enough going on, right? But thank you for being here today. And I think it's important that we have, again, student voices and people who are going to do this for the rest of their lives being featured. So I want to start by just saying thank you. Thank you for everything that you do that is so often behind closed doors, behind the scenes, serving people who, as the governor would call, are the lost, the lonely, and the left behind. And that work is so critically important for everything that we do in Kentucky. And, you know, the governor and I are probably your biggest fans. And we're so grateful for the work that you do across the state of Kentucky, because we believe that healthcare is a basic human right. And that means mental health care as well. And so this is one of the issues that I have really tried to champion through the Lieutenant Governor's office. My experience as a high school teacher, coupled with my Deputy Chief of Staff has a master's in social work and has done a lot of work in that arena. So we kind of actually had a really good tandem going to take on this issue. And so as we were, you guys are gonna have to forgive me because like 2020 to 2022 is all the same year to me, right? It's all a blur. But as we were kind of starting to come out of the pandemic, the first time we thought until, you know, whatever that other thing was that came along. What was that called, Secretary Friedlander? When we spiked again in the summer? It was not fun. It was not fun. Yeah. So as that kind of started to happen, not only did my experience as a teacher tell me this, but at the time I had my adopted daughter was a senior in college. I had two bonus sons that were senior and junior in high school, and I had an infant. We had everything. And the governor had two middle schoolers. We had everything covered, right? And my husband is still a high school teacher. He teaches at Frankfort Independent in Frankfort. And so I got all kinds of perspectives on things that were happening. Of course, the rites of passage that our kids didn't get that we got and probably took for granted. And I started to think about how the pandemic was going to affect our students and the culture of our schools when they return to the classroom, and really started to worry about how that was going to go, because we know there were so many kids that were at home, that were in homes that quite frankly weren't the best. And that was going to have a lasting impact on those kids. And of course, that was going to manifest between 8 and 3 every day in their schools. And so I kept hearing adults talking to other adults about student mental health, but I never heard them asking students how they felt or listening to students. And so we really set out to change that. And that's how the Student Mental Health Initiative was born. And so what we did was we borrowed the Student Advisory Council for the Department of Education, students from juniors and seniors from all across the state. And I just kind of convened them and I said, would you guys like to do some work would you like to lead some work on student mental health? And of course they jumped on it. They were so excited. And I said, now listen, I'm going to open the door for you. but this is your all's thing, right? Like I am perfectly happy with teeing you up. And then once you get in there, this is your baby. And they said, okay. So we planned 10 regional action summits around Kentucky. And this is how much it is theirs, because I wanted to call them roundtables and they told me that was boring. And I was like, that's fair. We'll call them action summits. So there were 10 regional action summits all around Kentucky. We worked with our educational cooperatives to plan out the sites and include folks. And we made sure that we had a counselor on site, because we wanted to practice, obviously, the things that we want to see in our schools, and to have support there for our students who might need it. And our student leaders, they developed the questions and facilitated the conversations in breakout groups of smaller students at each location, so that they could have a one-on-one conversation with their peers. And we had our Family Resource Youth Service Center folks, who are angels on earth and should wear capes every day. They're like my favorite people. They were in the back of the room, only there to take notes on high level themes, right? So we're not like trying to capture anything real specific, but we just wanted to see what kept coming up, right? And so once we gathered that data, our student leaders, then we handed it to them in room 110, where Governor Beshear does all of his press conferences. And we said, all right, let's dive into this, and you tell us what we need to do based on what you heard around the state. So from that, those students crafted 6 policy recommendations, and it's going to be nothing that surprises you, right? But it's reassuring both that they were focused on things that you know should be done and you are working on every day. And also it's reassuring to know that the work that you're doing every day is important enough that these kids know that it should be a top priority, right? Without any, prompting at all. And it was things like mental health absences at schools as excused absences. We did get a bill passed that was bipartisan, that created, it didn't really go far enough, but it created the opportunity for school boards to pass a language around mental health absences if they choose. The vast majority of schools chose to do that, which is really, reassuring. Now, that means that we have about 171 different practices around the state, but there's a few left that haven't done it yet. And I'm on that like a dog on a bone, because I'm not going to let that go, because I want every kid to have access to these opportunities. It was things like making sure that our teachers and school employees had better training and professional development around mental health, not to act as the mental health providers, because listen, if I taught social studies and I coached basketball, you don't want me giving mental health advice to kids. And I did not need to be, but I needed to know how to recognize and refer, right? That was the big thing that we talked about. And the example I always gave my students was, I was in the classroom for 14 years, and I was probably halfway through my career. I had become an assistant principal, and had a bachelor's degree, master's degree, and if I can ever write this dissertation, I'll have my doctorate, right? We'll get to that one day. But at that level, I had no training in anything that was regarding mental health or social and emotional learning. So that means that people from the halfway point up, at least, had no idea how to recognize and refer. And what I told them was, I had to take the bloodborne pathogen training every year. Thank goodness I never had to use it, but I had to do it every single year. That's the point. I never had to use it, right? But I had classrooms full of kids who were hungry, whose parents were addicts, who were couch surfers, who were in foster care. I could go on. And beyond just creating kind of a teacher-student relationship with them and getting to know kind of, their nature, there wasn't really anything else that I actually knew to do. And so creating that professional development for teachers, making sure that the professional development our teachers take is relevant, is really important. The big thing that we heard everywhere was updating the suicide prevention video. By the way, in some schools, they still use the VHS. I couldn't even believe our students knew what that was, but they do. Yeah. And so I got to give credit because the folks in that agency and state government brought in some of our students to say, how can we make this better? How can we make this more relevant for our students? And so again, lifting up those student voices and making them part of the conversation that's all about them is something that we want to make sure that we continue to do. And so there were 6 recommendations. They did a phenomenal job. You all know this. They are so much more socially and emotionally intelligent than we are. I mean, I just kind of sit back and listen some days. And the one thing that I will point out to you that one of our students said that just blew me away. We're diving into the data, we're sitting at the table, and I go into assistant principal mode when they say we need mental health excused absences. And I said, okay, are we going to require a note, like a doctor's note? And one of those students immediately goes, Lieutenant Governor, diagnosis is privilege. And I was like, I'm done. You all just keep doing what you're doing because I'm obviously in the way. But it was like one of those moments where I was like, golly, they get this because they live it. And so making sure, again, that we lift them up. They talked to over 300 students across the state of Kentucky. We had virtual meetings, we had in-person meetings. This was still when we were ebbing and flowing. And so we had masks and not masks and all the things, right? And thinking about those recommendations, they were very concerned with, okay, but how are we going to make them come to life? And I said, well, I got good news for you. There's more than one way to skin a cat. And so we took those recommendations kind of on a little bit of a roadshow, and we presented to state agencies, community partners across the state of Kentucky. We even got on the radar of the federal government, who we have presented with SAMHSA and all kinds of groups multiple times. And they've basically told us, we want Kentucky to take this on the road and show other states how you have done this by centering the students in the work. And I'm like, well, you just tell me when, and we're there. The one, of course, roadblock we ran up against was the state legislature. And so when we presented to the state legislature, we presented to the Interim Joint Committee on Education. And those recommendations were as clear as day. They're things that need to be done as professionals. They're things that the students believe need to be done as people who are going through this. And aside from the mental health days that allowed the boards to create that language, nothing else was done. And that's really concerning to me because in January, there was a Pew report that came out that said that the #1 concern of parents across the country is their child's mental health, the #1 issue, right? And so I told the students not to be dismayed because some people call me resilient, Secretary, and some people call me hard-headed. I'll take it either way. And so I decided with this new relationship we built with the federal government, I made the case to them. I said, listen, we are a state with a governor and lieutenant governor and our entire team, Kentucky, who is focused on this student mental health. We have made it a priority. Governor Beshear has been on board with this from the beginning and has really encouraged this whole process. And I said, so don't count us out as a state just because you're not seeing maybe some funding coming from our own budget in regards to this. Know that we need you, because if not for you, we're not going to be able to get this done given the political landscape in Kentucky right now. And so they responded, and we worked with our educational co-ops across the state to apply for federal funding. Now, this is not enough. It is not universal, and it is not a consistent method of funding. I'm going to say that outright. Okay, this is a Band-Aid for an issue that we know needs so much more attention. But I will say that in spite of the lack of activity or action from our General Assembly, working with the federal government, we have secured to date $42 million for school-based student mental health services for our kids. And we're still going. I get to actually make another announcement today about some more funding in Southeast, South Central Kentucky. There's more funding that's coming out to the West, and we continue to work with our co-ops. And I think the greatest compliment I've been given is we've never had an elected official reach out and proactively offer a letter of support. And I'm like, whatever you need to get this funding, we will do what we have to do because we know it's that important. And here's why. The ESSER funds that have come into the state of Kentucky, as you all know, over the last few years, schools chose to use them differently. A lot of schools chose to invest in student mental health and mental health providers, which is obviously a great decision, but there is a sunset on that funding. And so very soon, the state of Kentucky is going to lose $18 million in student mental health funding because it's going to sunset because of ESSER. And so we've got to, again, figure out how we're going to fill those holes and stand in the gap for those kids. And, I think about the opportunities that our kids have in a Kentucky that we didn't have. Since the governor and I were inaugurated, we have brought in $25 billion worth of economic investment that's creating about 45,000 jobs all across Kentucky. And I know we're in Lexington today, but let me just say this as somebody from Bergen, who you've probably never heard of, but we have 1,000 people in a 4-way stop and that's it. Okay. Literally, we're like 30 minutes down the road. So we ranked number 3 in the nation in rural economic development, which means every family, every zip code, every county, every region, every neighborhood in Kentucky has opportunity at prosperity, which, as we know, is going to change the trajectory for so many families moving forward. And so, those progress points are really important, but it's all for naught if A, we don't make sure that our kids are healthy, and B, we make sure that our schools have what they need. Those strands cannot be divided. Those are of the same importance in terms of making sure that we move our kids forward. And so this work continues. We're going to continue pushing for more funding, for more programs, more professional development, more employees in the student mental health arena, because I want it for every kid. I don't want it for just for the kids whose co-ops landed a grant. I want to make sure that every kid has access to this. And so we're going to continue working. This is going to continue to be a priority of the governor's and mine. Obviously, we're in our last year of our first term, we'll say, because I'm going to be positive, but there's a potential that we could continue this work for another 4 years if we do things right. And we certainly will. But, this is the important thing. And Secretary Friedlander alluded to this earlier. Team Kentucky is about lifting people up, not leaving people out. And so when we talk about progress and prosperity, we know that we have to make sure that that's available to every single person, regardless of who they are, where they live, or any of those other demographics that people may talk about. And it's not about right and left. It's not about DNR. It's not about red and blue. None of this stuff knows political party, right? Mental health is not going to stop and ask you what party you are before it decides to, invade your life. This is something that we have to make sure that we are continuing to make available for everyone. And it's about making sure that, again, we lift people up, because if we do things right, holistically, all around these kids, we can take 3 years of prosperity, of progress, and turn it into 30 years of prosperity. But we have to get this right. We have to get this right, because this is foundational to the success of these kids, to their livelihood, and to their future families. And so I just want to close by reminding you that we're on your side. We have the utmost respect for what you do. We are trying our best to support the work that you do every day. I do not know everything about student mental health. And so if there is anything that you see that is glaring, that you think we need to know, that we need to be aware of, please reach out to us and please let us know. I learn a little bit every day about this. Again, I told you I was a social studies teacher and a basketball coach. This student mental health is not really my wheelhouse, but I'm a parent. And I've been in the classroom and I know how critically important it is. And so it's something that I'm going to make sure that we continue to put out front with Team Kentucky for the rest of the time that we have the good fortune of being in the offices that we're in. So again, thank you for your work. Thank you for making this matter and for showing up today and for being the light for so many kids that need it. Thank you. I forgot one thing. Hold on. I was like, Secretary Friedlander, I forgot. All right. So I came to tell you about the Student Mental Health Initiative, but I also came because I have a proclamation from the governor, and it says, come on up here, Carol. It says, whereas addressing the complex mental health needs of children, youth, young adults, and families is fundamental to the future of Kentucky, and whereas mental health and wellness is a necessary part of an overall well-being for our citizens in the Commonwealth, and whereas there is a need for comprehensive, coordinated mental health services for children, youth, young adults, and families in Kentucky, whereas Kentucky's system of care strives to expand and strengthen the services and supports for children, youth, young adults, and families affected by mental health challenges. And whereas it is appropriate that a day should be set apart each year that encourages Kentuckians to seek and obtain mental health services in an atmosphere of acceptance, hope, and growth. Now, therefore, I, Andy Beshear, Governor of the Commonwealth of Kentucky, do hereby proclaim May 11th as Children's Mental Health Acceptance Day.